Good afternoon, everyone. Welcome to Facebook Live hosted by Island Hospital. I'm Dr. Mah Siew, one of the obstetrician and gynecologists attached to Island Hospital. I'm also one of the pioneers here. Next week, we will be celebrating our 24th anniversary. It's on the 16th of September. It's the same day as Malaysia Day, so we will always get a holiday on our anniversary. Today, I'll be talking on something that affects women, which is a very common condition. The topic for today is uterine fibroids, what every woman should know. In order to understand the condition better and the effects of the fibroids, I will go through the female reproductive system. Basically, this picture shows the female reproductive system. It comprises mainly of the vulva, vagina, cervix, uterus, fallopian tubes, and ovaries. Uterine fibroids arises from the uterus, which is this part of the female anatomy. There are three layers to the uterus. Basically, there's an inner layer, and there's a middle layer, and the outer layer. The inner layer is called endometrium. Middle layer is a muscular layer, and that's where the muscle cells are located. And it's the muscle cells that give rise to the condition called fibroids, the tumors in the muscle cells. And the outer layer is called the serosa. And this diagram shows the relationship of the uterus to adjacent organs. See, in front of the uterus, you get the bladder, and at the back is the rectum. So if you have fibroids growing on the front part of the uterus, you can press onto the bladder and cause urinary symptoms like frequency, whereas posterior uterine wall fibroids will press on the rectum, and if it gets big enough, it can cause constipation or difficulty in passing motion. Well, what are uterine fibroids? Fibroids are actually muscular tumors, meaning it arises from the muscle cells in the wall of the uterus. The medical term for uterine fibroid is leiomyoma, and it's almost always benign. Rarely it becomes cancerous. It can occur as a solitary tumor, or it can occur in multiples. More often than not, is in a multiple form. The most number that I've actually removed from a single patient is actually 97. That's my record from one person, 97 fibroids. The size can vary from very small, from 1 to 2 millimeters, to huge fibroids, can be up to tens of centimeters. There are different types of fibroids, and it's all based on its anatomical location within the wall of the uterus. If it is in the inner layer, in the endometrium, is called submucous, whereas within the wall of the uterus, it will be called intramural fibroids, and if it's on the surface, it's called subserous fibroids. Some fibroids are attached to the uterus via a stalk, so those are called pedunculated fibroids, like this one here. Who gets fibroids? Well, it's most common between the ages 30 to 40 years old. Rarely do we get in teens, except in certain ethnic groups that they do get it in the younger age. If you have a family history of fibroids, your risk of getting fibroids is increased by 3 times. For example, if your mother has fibroids, then your risk is 3 times above the average for the population. African Americans, they have a very high risk of fibroids, and they usually get multiple ones and at an earlier age. It's also associated with obesity. The obese people tend to get fibroids more often. What are the symptoms? Well, majority of fibroids are asymptomatic. That means they have no symptoms, especially if they are small. And when the fibroids gets bigger, it can cause a feeling of fullness in the pelvis. Fibroids are solid tumors, and they are quite heavy. So when it gets bigger, it presses on the lower abdomen, and you get a feeling of fullness. And some fibroids can grow very big. In fact, it can be up to the size of 5 to 6 months pregnancy size. And if it is in the anterior part of the uterus, it can presses on the bladder and can cause symptoms of frequent urination. And another symptoms that it can cause is dyspareunia. What that means is that it's a painful intercourse. See, the fibroids being located in the pelvis can press onto some of the ligaments and nerves in the pelvis. So during intercourse, the movements sometimes can cause pain. And of course, when it press on the nerve, you also can get lower backache. Depending on the location, fibroids can also cause problems with fertility, especially the submucous types, the types that lining the inner layer of the uterus where the baby normally sits. Another important symptom is menorrhagia. What menorrhagia means is that the periods are heavy. It can be heavy in terms of the amount of flow per day or the duration of flow. Uh, a normal menstrual cycle should last less than a week. If it is more than 1 week, then it's considered heavy. And during a menstrual cycle, you shouldn't have any blood clots. Blood clots only form if your periods are heavy. If your period is not heavy, then you will not form clots. The scientific sort of definition of menorrhagia is if you bleed more than 80 mils of blood per cycle. 80 mils of blood is taken off as a cut-off point because it's found that if you bleed more than 80 mils per menstrual cycle, then you are at risk of developing anemia. Your blood count will drop, and you, because of the excessive amount of blood loss, and your normal iron intake cannot cope with the amount of blood loss. Okay, if you have fibroids and if you do get pregnant with the fibroids, there are higher risk of complications during pregnancy. Firstly, if it is in the submucous region, then there may be problems with implantation, and in the later stages of pregnancy, if the fibroid is located in the lower parts of the uterus, then it can prevent the baby from getting into the pelvis, so you can present with malpresentation like transverse lie or breech presentation. The risk of having a cesarean section is also increased by 6 times. And after delivery, there's also more risk as well, because when there's a fibroid in the uterus cannot contract very well after childbirth, so there's a higher risk of postpartum hemorrhage, bleeding after childbirth. The cause of fibroid, well, the actual cause is not really known, but it is, what we do know is that it's associated with a few factors, namely the female hormone. Female hormone is actually known as estrogen. There are a few things that show that shows the effect of estrogen on the growth of fibroids. Firstly, we notice that during pregnancy, the size of the uterine fibroids tends to increase. Usually, it will double in size by the time you reach 4 or 5 months pregnant. This is because during pregnancy, your levels of estrogen is very high, and this high estrogen will stimulate the growth of the fibroids. It doesn't cause fibroid to form, but it will stimulate the growth if you have fibroids. And another evidence is that after the menopause, fibroids will generally shrink, or it will not grow bigger after menopause. See, after menopause, the female hormones is very low, so there's no estrogen stimulating the growth of the fibroids. Another thing is it may be related to your genes, as evident by the fact that certain races, certain ethnic groups have got very high incidence, and also by the fact that if your family has got a history of fibroid, you also have a higher risk. Can fibroids turn cancerous? Fibroids are almost always benign. The risk of cancer in a fibroid is roughly less than 1 in 1,000. We normally do not remove fibroid because of the fear of cancer. We remove it for other reasons, for other sort of symptoms. The main way that we make the diagnosis of uterine fibroid is through clinical examination. Sometimes they can grow until very huge size, and then the diagnosis can be very obvious. Like this picture here, this is one of my patients. She's not married, but her tummy looks like she's about 6 months pregnant. It's because of a huge fibroid within the abdomen. And sometimes when you go for a routine pap smear, which we recommend once a year, you can actually feel some pelvic mass on vaginal examination. And to confirm the diagnosis, the most common way is to do an ultrasound scan. Virtually all obstetrician or gynecologists will have an ultrasound scan in their clinic. So it's easily done, easily available, and it's not very expensive to do. See, with ultrasound scan, what we do is we capture images of the body by using sound waves. The sound waves, when it hit the body, will reflect it at different intensity depending on the density of the tissue. So this darker nodule here shows the uterine fibroid. Like this whole thing is the uterus. That's the lining of the uterus. So for an ultrasound scan, you can see clearly the presence of a uterine fibroid. In huge fibroids where the diagnosis is not very certain, sometimes we may opt to do a CT scan where you get a clearer picture. This lady has got multiple huge fibroids in the uterus. Because you get a better picture with MRI, nicer picture, but the MRI is not available everywhere and also much more expensive to do. It's useful if you want to do surgery and you want to know exactly how many fibroids there are and the location within the uterus. So it helps you to ensure that you will remove all the fibroids that's found in the uterus. Well, what are the factors affecting treatment? Well, first of all, you want to see whether there are symptoms or not. If you have no symptoms and the fibroids are small, then you can actually leave it alone. You can monitor it by doing regular scans. Some fibroids will stay the same size, some do grow. But if it starts to grow fast, then you may have to remove the fibroids. If you are concerned about fertility and you have fibroids, then you should consider removing the fibroids because it can affect fertility, and also if you do get pregnant, the presence of fibroid in the uterus may cause more complications during pregnancy. What's the size of the fibroids? If you have huge fibroids, inevitably you will cause symptoms, so it's better to remove them. You usually take 5 centimeters as a cutoff point. Then location is important as well. Those located in the subserous region or those that are pedunculated usually do not cause problems. Therefore, you can actually leave them alone. Some mucous fibroids will usually cause problems. The one in the inner layer, problems with heavy periods and problems with fertility. So these ones usually needs to be removed. And if your age is very close to menopause, and if your symptoms are not too bad, then you can try to bear with the symptoms or take medication to help control the symptoms and wait for the onset of menopause. Because once menopause occurs, the fibroids will get smaller and most of all the symptoms will actually go away. So you don't have to do anything surgical. You can take medications for symptom relief. Say if you get pain during periods from the fibroids, then you can take painkillers. You usually start off with simple ones like Panadol, or if the pain is more severe, you can get stronger painkillers like the NSAIDs, like Constant. And if the period is heavy and it's causing a bit of anemia, or you worry about getting anemia, then iron tablets will help. But of course, if the period is too heavy, the iron tablets cannot catch up with the loss of blood, and you will still end up with anemia. In those cases, you will have to treat the fibroids. You can take transamin tablets during periods. Transamin tablets are anti-fibrinolytic tablets. What it means is that it prevents the breakdown of clots. See, in our body, the way to stop bleeding is to form clots. If the clots get broken down, then the bleeding will occur again. So these tablets stops the breakdown of clots and stops the bleeding. So it can be quite useful. You can take it only during the periods. Oral contraceptive pills is also known to reduce menstrual flow. Even in people without fibroids, if when you are on the pill, you will notice that the menstrual flow is much less than normal. So it can be used to treat menorrhagia or heavy periods from fibroids. Normally, when we use intrauterine device is for contraception. And intrauterine device has the disadvantage of causing heavy periods. Normally, it will cause heavy periods. Some people cannot tolerate it and have to remove the device because of heavy periods. But with Mirena IUCD, it contains medication on the IUCD. The medication, namely a progesterone, will actually reduce the amount of blood loss. So you can use this type of IUCD to help to control heavy periods. And if it works, it lasts for 5 years. So just one insertion, and for 5 years, you don't have to worry about heavy periods. There are basically 2 types of medication to reduce the size of the fibroids, where we can help to make the fibroid shrink. One is what we call gonadotropin releasing hormone analogs, or GnRH analogs. This hormone is normally produced in our brain, in the pituitary gland, which controls the release of estrogen from the ovaries, and also controls ovulation. So it creates a pseudo menopause state. So when you have low estrogen, the fibroids will shrink. But unfortunately, you cannot take this medication for too long. It cannot be more than a year, because if you do so, you end up with problems of menopause like osteoporosis. And also, the reduction in size is also temporary. After stopping medication, the fibroids can grow back in size. It's useful if you want to reduce the fibroid temporarily before you do surgery. Also useful in people who are already approaching menopause as a stopgap measure, and then hope that when the menopause comes in, then everything that all the symptoms will all go away. Another medication that can actually kill off the fibroid cells and the myocytes, the muscle cells, is asthma or ulipristal acetate. It stops the fibroid cells from dividing, and this will lead to the death of the fibroid cells. Uh, Normally, it can reduce the size of the fibroids by about 40%. And with this reduction, a lot of symptoms will actually go away. But unfortunately, there are a few patients who took this, ended up with liver failure, and some have actually died. So this drug has been withdrawn from the market now. So there's no other alternative. The advantage is that you do not get menopause symptoms with this medication. There's a procedure that you can do to help to reduce the size of the fibroids. See, all tissue in our body needs blood supply to thrive and to grow. Same thing goes with the fibroids. The blood supply of the fibroid comes from the uterine artery. So if you can block off this artery, you can cut off the blood supply to the fibroid, and the fibroid will actually shrink. With this procedure, what we do is we put a catheter into the artery over the thigh, the femoral artery, and from there, under X-ray guidance, we push the catheter in until we reach the uterine artery, which is around this region. Once we have found the uterine artery, we inject some polyvinyl particles to block up the vessels. So it will help to relieve symptoms when the fibroid gets smaller. And the advantage is that you can preserve the uterus. Uh, some females would like to keep the uterus despite the fact that they may not want to have any more children, because it reminds them of their femininity. So this is an option for them. However, if you still have further wish for future childbearing, then this is not really an option, because you don't know how the effects of it is going to be on the uterus and subsequent pregnancy. Another procedure which is becoming more popular in recent years is what we call HIFU, high intensity focused ultrasound. Uh, what this involves is we focus a very highly intense ultrasound wave onto the fibroid. This will bring about thermal and mechanical damage to the fibroid. Is it when you have a lot of energy focused on the fibroid, the temperature increases. With the rise in temperature, the cells actually die off. And ultrasound waves also cause oscillation um, of the cells, and then this will lead to microbubbles and cavitation and leading to cell death. It's a non-invasive alternative to surgery, and it can be done as a day case, but unfortunately, this is not widely available. It's just coming into the market. It's ultrasound guided. It takes a bit longer to do the procedure as well. It takes about 2 hours to perform one procedure. Of course, there are also risks. Sometimes you can accidentally burn the skin, and you can also get collateral organ damage if the focus is not perfect. You see, a lot of nerves come from the spine, go down to the lower limbs. They have to pass through the pelvis. So sometimes these sound waves can affect the nerves, leading to back pain or leg pain. The ultrasound waves also can damage some of the vessels in the pelvis, leading to venous thrombosis, which can be quite dangerous. People with multiple operations before, with multiple abdominal scars, it's not suitable, because after multiple operation, tissues tend to get stuck together. So intestines can get stuck to the uterus, and then you can accidentally damage the intestines in this type of patient. This procedure is also most useful only for smaller fibroids. If you have multiple or very large fibroids, it will not be so effective. Of course, if you suspect cancer, you shouldn't use this technique. So after all the medical conservative treatment, then we come to the surgical treatment. Okay, that's the last part of the final stage for treating this condition. Basically, there are two types of surgery you can do: the more conservative or the more radical. More conservative one is just to remove the fibroid, what we call myomectomy. The more aggressive surgery is to remove the whole uterus, called hysterectomy. We do myomectomy if you want to preserve the uterus and you want to preserve fertility. Of course, so in the younger person who still wish to have children, we cannot take out the uterus. So the only option is to do a myomectomy. But the disadvantage is that we actually have to cut open the uterus to remove the fibroid. In doing so, there will be more bleeding, but it's always manageable. The post-op recovery is also more stormy, because there's a scar in the uterus, and the scar in the uterus sometimes they tend to get a bit of oozing post-operatively, irritates the intestine, so you tend to get more bloating after surgery and also more pain. And another major disadvantage is that 20% of people undergoing myomectomy will have a risk of recurrence. That means a fibroid will grow back in 20% of patients. Because if you want a complete cure, then you have to remove the whole uterus. Once you have done the hysterectomy, there is no chance of recurrence. But of course, you need to have completed your family. And there are two methods of doing this operation. There is two methods of doing myomectomy and hysterectomy. Traditional method is to do what we call a laparotomy, and the newer method would be to do a laparoscopy. In other words, keyhole surgery, where we use tiny incisions, narrow, long instruments, and operate through a camera system. So this picture shows how a laparotomy is done. You make a big incision, either vertical or transversely. Okay. If the fibroid is very big, say if it is above the umbilicus, then we have to make a vertical incision. Smaller fibroids, you can make transverse incision, which is cosmetically nicer. With laparoscopy or keyhole surgery, we usually make 3 or 4 small cuts, up to 1 centimeter in diameter. Over the umbilicus is where we put a camera in, and 2 or 3 other small incisions at the lower abdomen. This diagram just shows the difference between the two. See, these instruments with keyhole surgery are very long because we need to go through the abdominal wall to reach the pelvis and perform the surgery. The instruments are very similar to what we use in open cases, but except it's in the smaller dimensions, like scissors, forceps, and all this. Both techniques have their advantages and disadvantages. Well, the disadvantage of laparotomy is you get a large incision, you get a large single incision, whereas laparoscopy, multiple small incisions, and because of the larger incision, the hospital stay is much longer as well, usually about 4 to 5 days. Whereas with keyhole surgery, the stay is much shorter, only 1 to 2 days. And because of the larger incision, the abdomen is exposed to the atmosphere, so there's higher risk of infection as well compared to a keyhole surgery, and bleeding is also more. Therefore, with all this, the recovery time is much longer compared to keyhole surgery. So a lot of my patients after a keyhole surgery, they can go home the next day, and after 1 week, if they can go back to normal activities except lifting heavy things. Whereas with the laparotomy, they take up to 6 weeks to go back to normal activities. So the recovery is much different, and also it's much easier for the nurses to provide nursing care for patients with keyhole surgery because they need less painkillers, need to give less injections, so less work. And also they can mobilize faster. They can go to the toilet on their own without people guiding them there. So nurses are always happier when they do keyhole surgery. But the disadvantage of keyhole surgery is that the setup is much more expensive. You need to get a camera system, and the doctors also have to be specially trained for this procedure. Not all centers have trained people to do this. Okay. In conclusion, okay, there are few take-home points. Okay, uterine fibroids is a benign condition. Okay, we don't remove them because of the fear of cancer. We remove them because of symptoms. Okay, we need to treat based on the symptoms, and the type of treatment depends on your age and the wish of fertility. And if you require surgery, keyhole or laparoscopy surgery is the best option if available and if it is feasible. Okay, now we come to Q&As. Okay, first question from patient Kang. She's asked, what are the chances of fibroid turning malignant? Well, the chances of fibroid becoming cancerous is not high, less than 1 in 1,000. As I mentioned earlier, we did not remove fibroids for the fear of it becoming cancerous. We remove them because of the symptoms they cause. But of course, if the fibroids suddenly start to grow very fast, then you worry that it may become cancerous. Then in those cases, you have to think of removing as soon as you can. The next question is, low percentage of turning cancerous still means that there's a possibility. With that in mind, how often should one go for follow-ups, and what routine should be done to closely monitor? The best way to follow up is to monitor the size of the fibroids, you do ultrasound scan, which is non-invasive and which doesn't have any side effects, and there's no radiation involved. Do it every 6 to 12 months. And the other thing is also to watch out to monitor your menstrual periods. If it's just a benign condition, your periods will be heavy, but it'll be regular. Whereas if it becomes cancerous, the bleeding will not be regular. You will have bleeding in between periods, or the bleeding doesn't stop. So if you have intermenstrual bleeding or prolonged bleeding, then you should go for a checkup to make sure that it's not turning cancerous. Okay, some doctors say contraceptive increase the likelihood of fibroids, but others says it helps. Can you explain why is this? Okay, also a question from patient Kang. Well, if you look at compare people who takes contraception to those who do not take contraception, the incidence of fibroid is actually less. Okay. The contraceptive contains progesterone as well as estrogen, and it also provides a very balanced hormone ratio. So therefore, because of this, it actually prevents reduces the incidence of fibroids, so it doesn't increase. But if you take estrogen alone, of course, it's different. But our contraceptives are all combined, estrogen and progesterone. Another question for Lim Tan Chin. In what circumstances we need to do an MRI? Okay, most of the time you do not need to do an MRI for uterine fibroids. But if you are contemplating surgery and if there are multiple fibroids, then you want to know exactly how many there are and in what location it is, so that you will ensure that you remove all of them during surgery. Otherwise, you will miss removing one and leave one behind, then later on you grow bigger and cause problems. But it's not generally not done as a first line. Okay. And a question from Billy Tan. I removed 2 fibroids about 7 years ago and recently discovered I got 1 more. I'm 45 years old. Should I be worried or wait for menopause? Well, a lot depends on your symptoms. If you have no symptoms, you can just monitor the fibroids and wait for menopause. And also depend on the size of the fibroid. You are very close to menopause age. Average age is about 51. So hopefully you can wait until that time without any problems, and then the fibroids will get smaller. It will not disappear, but it will get smaller. Okay, another question on Ladona West. Should I still consider surgical removal of the fibroids even though the pain has dissipated? Well, if you have no symptoms and if the fibroids are not very big, then there's no need to remove the fibroids. And the pain may be due to other things, because if the fibroid is still there and the pain disappears, then it could be another cause of the pain, and the other cause could have disappeared, and then that's why you have no more pain now. Question from Yu Shen Kang. Assuming a patient doesn't have any serious symptoms, how many fibroids is considered too many to be left in the body, necessitating surgery? The number is not really important. It's the size and the presence of symptoms. Some people can have 10 to 20 small fibroids, not just a few millimeters each, and you have no symptoms, and you can actually just leave them alone. Unless you're planning to get pregnant, then you worry that when you do get pregnant, the fibroids will get bigger and affect your pregnancy, then you should consider removing them. Question from Miao King. Fibroids could cause anemia. Could we regularly take iron tablets? If yes, will there be any side effects of iron tablets? Well, you can take iron tablets regularly. Normally, our dietary supplement of iron is enough, but if you have heavy periods, then you may need oral tablets. See, the body has got a mechanism to block the amount of oral ions that you can absorb. Normally, only as of about 10%. So there's no harm. But where you can get side effects from iron tablets. Some people get diarrhea when they take iron tablets. Some people get constipation. Those are not sort of harmful side effects. But you can take iron tablets for long term. Question from patient Kang. Besides cost, in what circumstances should one consider open surgery versus laparoscopy? Is multiple fibroids an indication for open surgery? Well, if there's any suspicion of cancer, then you should not do laparoscopy. You should do open surgery. Uh, Sometimes the MRI findings can show features suggesting of cancer, or if you do a blood tumor markers, if they are raised, then that's suspicious of cancer. Then you should avoid doing a laparoscopy. And of course, if the fibroid is very big, then there's no place for the camera to go in and cannot see well, then you have to do open surgery. In patients with multiple surgeries before, and you think that additions are very bad, if you think that intestines, you see, after any surgery, things tend to get stuck together inside your tummy. Sometimes intestines will get stuck to the uterus. So in these type of cases, it makes like keyhole surgery much more difficult and riskier. So you may contemplate not doing a keyhole. What I normally do in this type of cases is I will make an incision away from all the scars, put the camera in, and have a look around first. If I think that you cannot proceed with keyhole surgery, then I'll immediately convert to a open laparotomy. Is multiple fibroids an indication of open surgery? If the fibroids, if there are many fibroids, I will opt for open surgery, because you can miss some of the fibroids with laparoscopy, because you don't have the advantage of touch. By feeling the uterus, we can actually feel the fibroids in there. With open surgery, you can touch the uterus. Question from Tammy Yo. Is there any particular food we should avoid to prevent cancers and fibroids? Normal food that we take will not cause any fibroids or cancers. Of course, certain medications can cause, if you take hormones, estrogen itself can cause cancer, but if you take unopposed estrogen, but if you always counteract it with a progesterone, that actually negates the cancer effects of the estrogen, because too much alcohol, smoking, all these are associated with cancers. So all these are lifestyle changes that you can control to prevent the risk of cancers. Ladona West question is, how often do you perform surgical fibroid removal? Well, it's a very common operation. I used to do at least about 10 cases a month, operation related to fibroid, either just removing a fibroid or doing a hysterectomy because of fibroids. But with this pandemic period, it's a bit quieter. But still, we do at least 1 or 2 a week. Patient Kang, what tumor markers to check for? There are a few female cancer tumor markers, CA19-9, CA125, CEA, alpha beta protein, but not all the tumor markers are not very specific. Okay, so it doesn't indicate specifically which cancer is going to be, and not all cancers will have raised tumor markers. If you have a normal result, doesn't mean you don't have cancer. But of course, if you have an abnormal result, then the likelihood of cancer is there. So once you have an abnormal result, you should go for further investigation, but not necessarily mean that you have cancer as well. Another question for Yu Shen Kang. How advisable is it for a young patient to take Leukerin, considering she would experience temporary menopause? Leukerin is a GnRH analog. It creates a pseudo menopause state. You can safely take it up to 1 year, but not beyond that. Beyond that, you will end up problems, long-term problems of menopause, like osteoporosis. Because when you take the Leukerin, during the time that you're on Leukerin, you will have symptoms of menopause, like hot flushes, sweating, cannot sleep, lethargy, no energy, dry skin. But all these are temporary and doesn't cause long-term harm if you keep it to within a year period. Question from Mel King. Fibroids could only shrink after menopause and not disappear. Will that shrink fibroids turn to cancers? No. After the menopause, when the fibroids shrink, they become sort of like a fibrotic tissue. So it's not an active tissue. there's no cell division, therefore it doesn't become cancerous. There's nothing to stimulate to become cancerous. Unless you start taking estrogens, that will stimulate again. So it becomes dormant and inactive. Question by Amy Chin. I just found out that I have fibroids after menopause for 3 years. It is 1 centimeter. What advice do you give? You probably have the fibroids before the menopause, just that it wasn't detected. And 1 centimeter is small. You don't have to do anything. If you are sure it's a fibroid, just leave it alone. But of course, you want to make sure that it's not something else. Your doctor can actually advise you on whether you suspect anything cancerous or not. If it is just a plain fibroid, no need to do anything. Okay, Ladona West question is, how serious is a degenerating fibroid? If a fibroid has degenerated, is it possible or not have any symptoms? Is it possible to not have any symptoms? Okay, sometimes when the fibroid outgrows its blood supply, some part of the cells will die off, and this is what I call degeneration. When it dies off, scar tissue can form, but sometimes the dead cells liquefy and you can get a cystic degeneration. Fluid will accumulate within the fibroid. Some people do not get symptoms, but sometimes it can be painful, the degeneration. And of course, if it is in the lining of the uterus, you can have secretions, a bit more discharge coming out from below. You can get degeneration during pregnancy of a fibroid as well. You know, the fibroid grows too fast, outgrows its blood supply, and usually those ones during pregnancy are quite painful. But it's harmless, doesn't cause any harm. Just have to bear with the pain or take painkillers to overcome that period, then they'll be okay. Once it's fully degenerated, there will be no more symptoms. Are there any more questions? If there are no more questions, then we will end today's session. Yeah, there's one more question coming in. Okay, Yu Shen Kang, could fibroids cause chest pains by any chance? Fibroids on its own will not cause chest pain because it's located in another part of the body. Because if you are very stressed about it, keep on thinking about it, then that can cause a bit of discomfort. Any stress can cause chest discomfort. But on its own, it shouldn't cause chest pain. Okay, if there are no more questions, then we will end this session. Yeah, there's one last question from Joel Sarabi. I've often been asked this question. She has asked me, Joel Sarabi, why did I become a gynecologist? I've never really known the answer for many years, but maybe subconsciously, I decided to take up gynecology because I lost my mother at the age of 10, when she was only 40 years old to breast cancer. So I thought I would like to help mothers to get through pregnancy safely so that no other child will have to go through the difficult times that I had to go through when I was a child. That's probably like the reason subconsciously, even though I never really think about it. Okay, if there are no more questions, oh, there's one more coming in. Okay, from BD Tan, if you miss periods for more than 4 months, does this contribute to the recurrence of fibroids? I don't quite get the gist of the questions. If you miss periods for more than 4 months, fibroids does not cause delay of periods. In fact, it only causes heavy periods. It doesn't delay periods. Of course, ovarian cyst, which is another condition, can cause missed periods. So I don't see how you miss a period. Missing a period can cause fibroids. I think that's it. Okay. If there are no more questions, then thank you very much for tuning in to this Facebook Live hosted by Allen Hospital. And I think we'll have another session next week by another doctor. Thank you.